because essentially what we're trying to do is take the guesswork out of blood pressure care. And right now, it's a lot of guesswork. My hope is that with this technology, we'll not just be able to identify blood pressure goals, we'll also be able to identify who's most likely to have adverse medication side effects, who's most likely to respond to what types of medicines, and maybe even more importantly, who's going to have a bad response to certain types of medications. That's really exciting, and I think I can't think of one provider who wouldn't want that information as they're sitting with their patient.
Hi, I'm Stephanie Whitehorse, Director of Intellectual Property at WARF. I had the pleasure of working to help patent this Innovation Award-nominated invention. If you have a UW-Madison invention you'd like to disclose to WARF, please reach out to me directly or at the link shown below. And now, more information about our nominee.
High blood pressure or hypertension is a huge problem in this country. It affects over 100 million people and is the major leading modifiable cause of cardiovascular disease and death. And there's considerable disagreement among different medical societies and professional societies about how aggressive we should be with blood pressure goals. So of course we're gonna recommend that individual change their diet and cut down on alcohol and work on healthy weight loss. But many people, despite doing all of those things, still have high blood pressure. And so now we need to introduce medications. A lot of the medications that we use to treat high blood pressure can have side effects. People can have their blood pressure drop too much, or when they stand up, they get lightheaded or dizzy, which can be really debilitating for an individual and can actually be significantly risky for an older adult who's more frail and potentially predisposed to falls. This is a huge problem because if we don't know how to treat our patients, we might not be doing them the best service. What myself and Dr. Ryan Pewowaruk have developed is a way to separate the components of blood vessel stiffness into the component that's due to aging, normal aging, and the component that's due to high blood pressure. The way that we envision it being used is a provider would measure the blood pressure in an older adult and say, okay, we know that your blood pressure is high, let's measure your blood vessel stiffness and split it into the two components, the change due to structural changing and aging and the component due to blood pressure. And if you have a high component that's due to blood pressure, we should be treating your blood pressure more aggressively to try and decrease your overall stiffness. And the way it works is we have an individual who we measure their blood vessel stiffness in a traditional way with any modality. And then what we do is we fit that particular individual to a patient-specific model where we know from how blood vessels respond to stimuli what their blood vessel stiffness would look like for a variety of blood pressures. We've tested out our technology in an existing large prospective cohort, and it definitely has significant promise. These parameters of blood vessel stiffness have been shown to be strongly associated with bad heart disease outcomes like heart attacks, strokes, death, and also dementia and kidney disease. And I think that's really exciting for a lot of companies that have blood vessel stiffness technology, because we all know it's not the best risk predictor out there. By adding our tool, you can still have cardiovascular risk prediction, but you also get so much more information that relates specifically to blood pressure and age-related changes in the blood vessels. It's really looking at your blood vessels, your physiology, and putting it in the context to you, which I think is really, really fascinating and has the potential to revolutionize blood pressure care worldwide.
Hi, I'm Janine Vermania, the Senior Director of IP and Licensing. If you've liked what you've heard and want to know more about this promising innovation, please reach out to us using the contact information on your screen. And don't forget to like and subscribe for more great videos from WARF.